wanted to take this time to be here today to show you some really neat treatment that you can do for yourselves to really make a difference in your health in conjunction with taking the Nutritional Frontiers supplements with Dr. Weiner and Jamie. And I kind of learned from the last talk what I could cover right quick that will help here, because I know a lot of people are waiting for me to test them. So I want to just briefly explain to you this technology, and you'll find that it's going to be very useful to you. Everybody has got so many health challenges, and anymore you just don't know what to do. And by coming here, of course, you learn about so many wonderful ways of being helped. So I want to introduce you to an additional way that's going to really be the icing on the cake for every imaginable condition you're dealing with. And it's very simple to use, and I want just to show you how to use it. This technology has been around for a long time overseas. It's from Germany originally. And they have a lot of technology up over there. They're very ahead of us with things. And this is an example of that. This is called microcurrent, and you have a handout on it. This is low-frequency electricity therapy. Electricity has been used for many years as therapy for many, many health problems. They call it energy medicine. And the Europeans discovered that very low-frequency electricity is very healing to the body. And I'm going to show you in just a minute why that is. You've got to remember something. You've got 120 trillion cells in your body. And every cell of your body has a battery pack. And as we age, the battery pack runs down. And with that battery pack running down is what causes us to have illness, serious illness. When you use this technology, you run up the battery pack. It's like recharging it. And when you recharge the battery pack, the body heals. No matter what the condition is, it goes into healing. Okay? What this also does, this technology, is everything you eat has to get into your cells. It's called the ability for the nutrients that you're eating today to nourish your cells. If you don't get nourishment into your cells, you die. You have serious problems with health problems. When you use this technology, it improves and increases the ability of the nutrients to get into your cells. So thus you get nourishment, you benefit from it dramatically, and you go into healing. I'm sorry? Absorption, actually, absolutely. Increase the absorption by 30 to 40%. The third thing it does, this technology, is it helps every 30 days our cells die off and get rebuilt. When you use microcurrent, it helps to rebuild what they call protein synthesis. It speeds it up. It speeds up the active healing of your body, the quick healing, if you will, when you use this. So again, you can see where that could be very critical to your recovery in healing and being able to counter whatever the health problem is. It affects, in our body we have what are called T lymphocytes, killer cells. And those killer cells seek out and destroy virus and bacteria, because we're exposed to virus and bacteria and parasitic yeast every day. The ability for our bodies to make these killer cells is very critical to us, but as we age, the killer cells production drops off. When you use this technology, it increases the body's ability to make these killer cells. So you can see where that would be a huge need for, because what is really the cause of cancer? The cause of cancer is that our immune system is depleted, and these virus and bacteria and bad cells are multiplying in us, whereas our body has the ability to fight that. But unfortunately, as we're aging and with stress, it gets depressed. But when you use this technology, you're stimulating that. Are you with me so far? It helps with blood sugar. People, we know that there's an epidemic of what? Diabetes. People have problems with their blood sugar getting stabilized. So what we find with this technology, it will help to stabilize your blood sugar. So that's a beautiful thing if you think about it, because you can be on beautiful nutraceutical supplements like Sugarsol, for example, from the Nutritional Frontiers, let's say. And you're finally changing your diet over to eating healthfully, and then you use this. So if you have diabetes, I can't tell you the countless number of patients that we have that are reducing their blood sugar that can get off insulin because they are using the nutrients, they are making a change in their diet, and they're using the microcurrent. And we're getting them off of diabetic medications, we're getting them off of insulin, we're reducing their insulin. Okay, are you with me? All right. Other things that this does too, it is a powerful anti-inflammatory. The cause of all your problems, your health problems, is inflammation that's in your body. When you use microcurrent, we can reduce the inflammation, and I'll show you points that you can stimulate. So if you're suffering from fibromyalgia, arthritis, any kind of pain, inflammation is the cause of all diseases, all cancers, all everything, all aging. This helps significantly reduce the inflammation. So the beauty of this technology is we take it and we combine it with the Nutritional Frontier specific products that you all are getting today and diet changes, and you are going to see an accelerated ability to overcome whatever health challenge you have. I guarantee you will see amazing things start to happen because of all of this and how it works together very synergistically. Now, did they give you a handout for my talk today? We do have a handout. No, there's actually another handout. This whole PowerPoint that I have is on a handout. So before you leave today, ask them to give you a handout on my PowerPoint. And by the way, for those of you who want to get a hold of me, I can give you my phone number. I've run out of cards, but if you want a copy of my PowerPoint, I'll be more than happy to send it to you if you want to write my number down. And if you get scanned by me, it's going to be on the hand and foot chart. But my number is 386-274-2520. 386-274-2520. Now, I have this particular slide up here because I want to get right to it. I don't want to waste your time too much. I know you all are on a schedule, and I've got to start back testing, folks. But I want to just kind of get to the 386-274-2520. Okay. I want to get right to it. I want to show you how you can use this little device to work on yourselves and to start overcoming whatever your health challenge and problem is, okay? First off, who in this room has problems with pain? Show of hands. We all do, right? So I want to show you some things that you can do for pain right out of the gate, okay? Now, you can do it a couple ways. You can take this, and the way this works is you push the button here. See that button there? I just pushed it and the blue light came on. It's on now, right now. And it's emitting, when I make a contact with that silver piece to the point, it's emitting a low frequency electricity. And according to the research, the friend of mine who developed this took, according to the research, the most healing of the frequencies for healing and pain control, and it even has cosmetic applications for lines and wrinkles. We won't have time to go over that today, but I want to show you how to work on pain, because that has tremendous effect on pain, and I want to show you how I also accelerate the healing for whatever your health condition is. So let's say, who has pain? Give me some areas you have pain. Back, okay. Okay, let's go to a slide here. There we go. Okay. Neck, shoulders, and entire back. Wherever it is the pain, here's how you're going to deal with it. Okay, for those of you who have pain, and you're going to get one of these, but you've got to have a significant other at home. If you don't, just dial a friend. So what you're going to do, you're going to have somebody help you with this for this part of it. You're going to lay on your tummy, and they're going to touch on the X's with this right here. You see these X's here? That's for the lower back. The 4 X's are here, 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 and here. That will get rid of that will work on the pain in the back. Are you with me so far? Those 4 areas. Alrighty? Now, the neck and the shoulders. They're going to work on the shoulders. There the X's are. And they would work on the neck. There would be X's up here on the neck on each side. Are you with me? All it is 30-second application. When they contact you, though, they're going to have their finger on the strip, Are you with me? And they're going to be touching on the X, and then they're going to put their hand on somewhere else on your body. It's like completing the circuit. Are you with me? And all it involves is a 30-second application, okay? 30 to 60 seconds the most, twice a day. The more applications, the better. If you do it 4 times a day, that would be more awesome if they did it for you. All right, okay, so I'm just covering back pain right now. By the way, get with Jamie so that when you have pain and you're using the Mighty Mini, you also want to be on the protocol that they have from Nutritional Frontiers to reduce inflammation, which they have a specific protocol. And if you use that in conjunction with using the Mighty Mini and being on a diet of eating foods that are not inflaming. Dr. Weiner, you have a protocol, don't you, for inflammation that we can give them? Pain and all that?
We have a whole book that they give when they buy the unit.
Okay, but I'm saying as far as Nutritional Frontiers, supplementation that we use. Okay, I indicated in conjunction with using the Mighty Mini. And they also have the Nutritional Frontiers, a handout on foods that are non-inflaming foods you want to start eating. Okay, because there's foods that you're eating in your diet that are creating inflammation and creating pain in you, okay? Okay, so are you clear on what parts to activate on the back? Okay, let's go to the next slide. The therapist's finger is on the other side of the neck and you hold for a minute. So see what they're doing is if you're working on the neck, you need me, Doc? If you're working on the neck, you're going to take this, go on one side, and if it's somebody working on you, they take their other finger. Are you with me? Okay? Or they can put it on the same side. So once that person working on you puts the finger on another location, the circuit is completed. Are you with me? So lots can be accomplished. Now, let's say you want to affect the pain by yourself and you don't have somebody to work on you. What do? Well, when you get one of these, there's a booklet that will show you some what are called major power points that you work. But let's try them. Everybody hold up their left hand. Oh, sorry. Okay. Now this is what you can do when you're vital and you're full of good nutrition. And this is like I want everybody to be able to do what Dr. Weiner just did here. This is what it's being alive and healthy is all about. Okay, got your hand up. Go in between your index finger and your thumb. Index finger and thumb. I'm going to show you some pain control centers, pain control points. Right there, the web. It's the web. You see it? Go into the web. Everybody activate that web for a minute. Touch it. Is it painful? Is it sore? No. Does somebody raise your hand, any soreness when you do that? Okay. Somebody out there, do you get some soreness when you go there? No. You get some? Okay. This is a pain control center. It's a body balancing center, an acupressure point that's very critical to balancing the whole body. You can take your Mighty Mini, activate it, and go right to that point. If you're doing it to yourself, all you have to do is keep your finger on the metal strip. You're right on it, and there you go. And I'm feeling it right now in my index finger because my point is active. I have yet to find somebody in my room that hasn't touched there and not felt something yet. And I've gone through almost 25, 30 people so far. Okay? This alone will start balancing out the energy going in here. Will start in Chinese medicine, as they call it, a major power body balancing point. It starts to work on activating the healing and reducing pain. I had a woman that couldn't raise her arm up in here earlier today, and I went right on that point, and I asked her to raise her arm. She started raising her arm as I was touching right on that point. Okay, that's one power point. Another power point is find your side of your knee. Outside of your knee there's a notch. You feel that notch? It's kind of like a notch there. And just that's your second power point, and you just put it right into that power point with this. Okay, these are pain control areas that you can activate. I'm going to show you a few more on the hand in just a minute.
By doing that, does it take care of pain?
It does affect pain. Yes, in fact, I'm glad you asked that. She asked, if you do that, will that affect pain in the knee? Yes, in fact, wherever you have pain, you can go right to it directly with this, and within a few minutes, you'll reduce the pain. Wherever it is, yes?
When you touch those points, do you have to complete the circuit somewhere?
If somebody is treating you, but not if you're treating yourself. If you're treating yourself, you just keep your finger on the metallic thing and you just go to wherever the pain is. Yes.
So I have a mother, 97.
Yes.
She can no longer have injections.
Yes. Yes.
Pain is going down her arm.
So if I would do for mom, here's what I would do. I would work the PowerPoint I showed you first. Then I would take it and take your finger before you do anything with her and push your finger where she tells you it's really tender. And then take this and go right to that area. But you got to touch her in another area too to complete it. You see what I'm saying?
One hand I touch
Yes.
there,
Yes.
the other one.
And with time, she's going to start really feeling it better. Seeing it different. Yes. But those points, no. Actually, this is what I'm telling you now, because that part is not. Remember, it's a good question. You take with your finger first and find where, if you have a shoulder area involvement, find with your finger where the sore spots are. But you can take this and find them too. It'll give you a pins and needles feeling, like a throbbing, a pulsing, if you will. So when you put this in an area and you start feeling a pulsing in a joint somewhere, a muscle, and it's pulsing and it's throbbing or whatever the feeling, that means that that's inflamed. That's an inflamed area. And this is going to deactivate. It's going to reduce the inflammation. Yes?
Are these points that you're identifying
Yes.
the same as trigger points?
They're exactly that.
They are
There are trigger points. And if you are familiar with trigger points, even better. You just start working on trigger points with this. I had somebody in here earlier today who they use essential oils. You know what essential oils are? Does anybody in here use essential oils? This is capable of what's called ionphoresis, which means it can drive the oil in. So you can take a drop of an oil, essential oil, or even for cosmetic. I have my patients that have, they want to work on lines and wrinkles. Who in here uses vitamin C serum? Okay, you can take that and on your face, wherever you want to go, you can drive it in with this. But you can do the same thing with anything. You can drive it in with this, but just a little bit. Yes?
Question. I have a daughter with a traumatic brain injury.
With what?
Traumatic brain injury.
Okay.
Will that help with spasticity?
Absolutely. And I'll tell you how to work with the spasticity in a second. Because with spasticity, when the muscles are in spasm, one of the things this does is it works on reducing the spasming when you go into that area. So where's typically for her is the spasticity? On the right side? Okay.
She's now starting to move her arm a little.
Make sure you get with me before you leave today. But I will show you in general, you're going to work some on the right side, starting with the occiput here. There's 2 points, one here and one here, that control that right side. And you work those areas into releasing the muscles. The spasticity starts to release. You can literally go, yes, you can do some stem on the voice as well. You can go right to the voice box with it. You can go anywhere with this. This is the beauty of it.
Never had a seizure.
That's okay.
Without cause?
No, none. Actually, we use it to reduce seizures.
Nice.
Okay, I have patients that use this on neuropathy. Does anybody in here have neuropathy, pain in their feet? I mean, this has, just amazing because again, it's working on the level of the cell. It's working, as I explained, on ADP and the gradient transport and the protein synthesis. Other questions as we're on the pain control? Yes.
Show me the point on the knee again.
Okay, the knee is going to be the side of the knee, the lateral, that's a notch. That's going to be a major power point on the knee, that side notch. Another one, when you buy a Mighty Mini, they're going to give you a booklet, and there's another power point that's right under under the sole of the foot. That's another power point. If you want a quick energy stimulation, do that point. Remember I said that's your point. If you want to get your energy up real quick, that's a good point for it. But let's go back to the, let's see. Oh, when you work on your other half and they have back pain, that's where you're going in. You're going in where it has the X's on the gluteal, the cheek. They're going in right in where the cheek is with this. You can't believe the results you get with back pain when you work on those points. It's amazing. Amazing, yes.
So could you also say then that what this does is it relaxes the spasm so that the circulation increases?
What it does is it works on, the question is it relaxing the spasm? The answer is what it's actually doing is initially it's reducing the spasm, it's reducing the inflammation, but it's working deeper because on a cellular level, it's affecting the ATP and cell gradient transport and protein synthesis and all that. So on a deeper level, that's what's causing the healing. Every time you use this microcurrent technology, you are working on a cellular level of healing the body. Just the same way when you're putting good nutrition, like the nutrients from Nutritional Frontiers, and your dietary changes, all that together works together to accelerate the healing process of your body rather than taking the pharmaceuticals and the chemicals, and all that's doing is covering up the problem and getting nowhere, okay? Let's go down to, we've covered the pair. Okay, let's go back to this again. Okay, I wanted to show you some more points because when you get tested by me today, what I'm basically doing is I'm scanning these points and I'm finding where there's hot spots. Now, what do I mean? When I put this, let's say let's go to the lymph. Let's start with lymph. Everybody hold up your hand, find the outside of your nail bed, the very outside the thumb on the outside of the thumb. That nail bed, that's your lymph system. You've ever heard of it? Your lymph system is your body's septic tank. It gets backed up. We all have lymphatic congestion, some of us more than others. What does it cause when your lymphs are congested? Inflammation, pain, arthritis, cancer, diabetes, you name it, it's all caused from lymphatic congestion. When you start decongesting your lymphatics, you will overcome major health challenges. Now, what I've been doing all day long is pointing you in the direction of what Nutritional Frontier product to be on to decongest your lymphatics while you're using the Mighty Mini to work on that outside nail bed. So what I'm going to do when you come to see me is I'm going to take this, go right to the outside nail bed, and what you do, right now I can't do it because I'm so congested, my lymph system, I can't even touch it right now, okay? See, doctors, we're the same way. We need to work on ourselves. The point of it is that when I scan you, you're going to feel a pins and needles feeling or a pulsation or some kind of feeling, and that's going to tell me that that area is congested, it's backed up. And then I'm going to show you, I'm going to circle on a sheet that looks like this, the areas that you're going to go home with this Mighty Mini and work on those areas, along with taking from Frontiers, what you're taking and whatnot, and you are going to start to see a change. And if you did nothing but work on your lymphatic system all alone for a month, and just did that, and took the Nutritional Frontier protocol for that along with it, I know that the majority of your health conditions would significantly improve. In fact, I will state this unequivocally, and I did this in the last lecture. If you did nothing but work on these three areas, your lymph system, your colon, and your adrenals, I guarantee unequivocally that 90+% of whatever you're challenged with is going to be overcome. Absolutely. I can tell you that unequivocally, okay? Why is that? Because your lymph system is, like I said, the cause of inflammation. Everybody in this room has got a colon issue because everybody in this room has got yeast, virus, parasite, and bacteria in their colon. No doubt. And to what extent is the question. But it's that yeast, virus, parasite, and bacteria that is causing the cancer, that is causing the inflammation, that's causing the diabetes, that's causing, you name it, because you've got these microbes. Because, as I've said, by show of hands, who in this room has never taken an antibiotic? The beginning of antibiotics is the beginning of the demise of your body. It is what is killing off this country is the overuse of antibiotics. My sickest patients are the ones that are on extended use of antibiotic. I'm going to give you a quick personal. 2 weeks ago, I went in for a non-invasive procedure on my left leg. Just all it was is a laser of my vein. And I went on an antibiotic and a prednisone, and the following week I was in the hospital with a horrible infection. Against my good judgment, I did that. So the bottom line is, everybody, all of us, our gut dictates our health. So you've got to kill off these microbes. because you are covered up with them. You got to kill them off. So how do you kill them off? You get on, Nutritional Frontiers has a product called Candikill. They got a product called Microcurrent. You got to be on that. You got to get on a probiotic. Everybody in this room needs to be on a probiotic. So you get on their probiotic. Number 3, you get on a way of eating that stops feeding the microbes. Do you know what I'm talking about? You've got to start eating a yeast-free diet. Are you with me on this? What is the American diet? The American diet is a yeast-friendly diet, is a microbe-friendly diet, because what is the American diet? It is starch, it is bread, it is sugar, it is dairy. So you're literally all day long feeding the things that essentially in the end are going to cause cancer in your bodies. And what do we do when we go in the hospital? What do they feed you in the hospital? What's a hospital food? Sugar. I just had this conversation with one of my gals who I just tested. She's a nurse for years, and she worked in assisted living. What are they feeding those people in assisted living homes? Sugar. And they're like zombies, and they're covered up with illness. So the point is, you've got to get rid of the sugar, ladies and gentlemen. Go home and throw it out the door. Open your window, throw the sugar out. You've got to get on a yeast-free way of eating. What is a yeast-free way of eating? No bread. But if you want yeast-free bread. Does anybody in here know what yeast-free bread is? Anybody? Raise your hand. Does anybody eat yeast-free bread? Ezekiel, did I hear that? In Pittsburgh, do they not sell yeast-free bread here? I'm sure they do. Ezekiel, right? Best bread, and it's biblical. You want to know how to be healthy? Open the Bible. Number 2, get off of dairy products. Stop drinking the milk. Stop drinking the milk. You want to stop the inflammation? You want to stop feeding the microbes that are going to cause cancer in your body? Stop drinking the milk. Stop eating the cheese. Okay, get on feta if you have to, not because I'm Greek, but that's probably the safest cheese you can eat. Okay. Now, I'm emphasizing this to you because your colon and your lymph and your adrenals are the cause, the fatigue of those 3 systems are the majority cause of every illness that you are now facing in your life. There's no reason why you should be suffering. There's no reason why anybody in this room at this point needs to be suffering, because you're already here. You're at the right place. We're giving you the information. No more excuses. You go out there and do what we're telling you and spread the word. One candle lights many. Yes?
What about almond milk or coconut?
Almond milk is great. Dairy-free, dairy-free. Almond breeze. Who in here drinks almond breeze? Good, isn't it, right? Who in here likes like rice milk? Good stuff, right? Who in here can tell me that they are now watching their intake of the white stuff? The breads, the pastas, rice? Raise your hand. Excellent. Okay, good deal. You want to lose weight? Get rid of the white stuff. You want to lose weight? Eat yeast-free. You want to lose weight? Start working on your lymphatics, your colon, and your adrenals with this Mighty Mini. And how do you do that? All we're going to do is we're going to go right on those points that are shown. I'm going to scan you. I'm going to show you their hot spots, and then you activate them for 30 seconds. You do that twice a day, and you will be amazed how the acceleration of healing will occur in your body. Everybody's got adrenal fatigue in here because everybody's got stress. I've asked that before. Who can tell me in this room they have no stress? It's impossible. But it's that same adrenal fatigue that is causing you to be exhausted, that is causing inflammation in your body, that is the source and cause of your immune system being run down. It's causing you to be depressed, you can't sleep, you've got all kinds of stuff, and then you've got you taking antidepressants and antipsychotics and on and on and on and on, okay? All you have to do is restore and rejuvenate your adrenals, yes.
What about fibromyalgia?
Fibromyalgia, great question. Same thing. Fibromyalgia comes out because your lymphatic system is backed up, number 1. So you decongest your lymphatics with the Mighty Mini. You kill off the microbes by working on the colon, and you work on your adrenals. If you with fibromyalgia, which is another name for inflammation in the muscles, right, and joints, which is caused from lymph congestion, microbes, and adrenals, if you work on those 3 areas, no more fibromyalgia. You can take all the anti-inflammatory arthritic medications and throw them out the window, absolutely, and you'll feel relief, you'll have energy, you'll feel like a different person, honestly. So what I would do with the fibromyalgia quickly is I would put you on some Nutritional Frontier protocol specific to the lymph, the colon, and adrenals. I would have you take this Mighty Mini, start working those points every day on both hands, 30 seconds at least twice a day, and also those power points that I showed you. So if you work the points, you take the protocol, and you get yourself on a yeast-free way of eating. And by eating yeast-free also, you're eliminating foods that are inflammatory foods, right? Remember we said the white stuff is inflammatory, dairy is inflammatory, okay? Get rid of that stuff, absolutely, you'll see a big difference. Yes?
Can I ask you, do you have any for glaucoma?
Glaucoma, a good question, I'm glad you asked that. Glaucoma, again, a couple of things. We want to look at the circulation in the vessels of the eyes, that they get plaquing in the vessels. So you want to enhance your circulation for one, and Frontiers has got wonderful protocol for that. You want to use the Mighty Mini. Now I have many patients that we can literally improve their circulation by going to that finger, you see, and it says circulation. You see that? It's your third finger. Your third finger. Okay, you go to the circulation point on the third finger. You see it, everybody? Yeah. Simply. And that is your circulation on both hands. That you would be, everybody, as I said earlier, has circulation problems. You've got to address your circulation to have healing occur. And you do that by being on nutrition for circulation, using the Mighty Mini to work on the circulation points. Okay? We see a lot of great things happen because circulation is so important to your body. We see a lot of good healing happen from all kinds of conditions because your circulation is improved. Don't you think it's and I asked this earlier today, you hear more and more about people that are developing blood clots with just routine procedures. Don't you wonder why all of a sudden you're hearing more and more people with blood clots? Are you noticing that? Well, it's not that it's all of a sudden. It's because the circulation of most people is not good. Their circulation is not good. So you've got to pay special attention to your circulation. And you can do some wonderful things, especially with the Mighty Mini, to work on your circulation.
I have one of those.
There you go. So you know where to work, okay?
I'm trying it. I mean, it's
Keep working on it. And you can literally go around your eye with the Mighty Mini too and affect the eye. You can actually find points around the eye. Just go around the eye and find active points. What are active points? Again, you'll feel like a hot spot there. Pins and needles feeling, 30-second application.
30 seconds.
30-second application. Yes?
What about soy milk?
Soy milk is, I know it's very controversial, soy is. It's just all in where the source of the soy is. You don't want to be getting genetically engineered modified soy, but the problem is they don't label things to tell you. You know, a lot of stuff you eat today, they don't even know it's genetically modified. But I think to be on the safe side, I kind of want to lean more towards the non-soy stuff for right now, unless you know what the source is. So here's what I want to show you the rest of the way. When you come in to see me today, before I leave, I'm going to scan you through. I'm going to find out what points are active, that you're going to feel them as pins and needles feeling, and then you're going to go home and work on them. Okay? Are you understanding what I'm saying? But all I'm saying is by working on these points, it's helping you to overcome whatever health challenge you're dealing with. And it's an amazing, and you will within 2 weeks begin to see changes happen when you implement microcurrent therapy. It's really phenomenal. It really is. But it's a kind of a, raise your hands, those of you who are in this room right now, how many of you are taking the Nutritional Frontiers products? So most everybody is. So once you add in the microcurrent, you're going to accelerate. I call it a potentiator. It increases the strength and power of the nutrition that you're putting in your body to the 10th degree. To the 10th degree, okay? What other questions do you folks? I did this a little differently this time around because I didn't want to make it too long, and I found that if you all could understand the basic principles of what this is all about and what I'm doing, when you get back there and let me test you, you will have an understanding. How many in this room have sign of hands are still on the list for me to test? How many people do we have? We have a sign-up sheet, but I've got you back there. I'm going to get you. I'm only here till about 5 o'clock, so I will work as hard as I can to get through everybody because I want everybody to at least experience this, okay? Unfortunately, I will be in my office in Florida on Monday. I got to leave tomorrow. But the next time, now I will be back here October the 18th, I think. But I'm doing a webinar for those of you who are going to get the Mighty Mini, I am going to be doing a webinar on October, I don't remember. Does anybody remember when I'm doing that webinar? October 28th, I think. We've got a calendar of it. So I just want you all to know, I'm here. If you just want to call me, unfortunately, I've run out of cards. But if you just call me, and I mean, any questions you have, but this is pretty straightforward. I'm going to at least show you today. Once I scan you, I'll show you what points you need to be focused on for you that pertains to your health problem. Send you home with one of these, and that's what we're going to do, okay? Do you have any other general questions that I can answer for you? Yes, yes. The sign-up list is full. Okay, somehow, even if it's full, we'll get you. We'll get you, yes.
Does it work for depression?
Tremendously, because, and I'm glad you asked it, her question was, does it work for depression? The cause of depression is adrenal exhaustion. Okay, your adrenals are very depleted. You know, so many people are actually walking around today with what's called post-traumatic stress syndrome. The average person is experiencing, because there's so much stress overwhelming people, that we're suffering from what the soldiers are coming back from Iraq. Because of everyday life is getting so horrific for so many. So what happens is the adrenals can't handle it anymore. They shut down. What is the first sign of your adrenal gland shutting down? Panic attacks, anxiety, depression, inability to sleep, muscle pain and ache, joint pain and ache, on and on and on and on. So what is the traditional medical people, the care they would say, here's an antidepressant for you. Well, guess what? That's just treating the symptom. We're still not doing anything for your adrenals. So what do? We get you on some Adrenamax from Nutritional Frontiers. We get you on some adrenal tincture, and we start with the microcurrent. Stimulate that fourth index finger. You see that fourth finger? Right there, adrenal. And you will start feeling like, wow, I'm not depressed anymore. I feel so much better. I don't want to sleep all the time. I want to do things. You know, on and on and on. Okay? Are you understanding what I'm saying? Yes.
Is there a website?
Working on it right now. This has been a work in progress for me because I am so busy in my practice in Florida, and then I'm teaching all over the place. So I'm putting together a website as we speak. In fact, you all have been so helpful to me because now I figured out what I need to be putting on there that you all will find of interest. But do me a favor. If you all want to be on my mailing list, would you do me a favor and make sure, just leave your name and emails if you want to be on my mailing list. And I'll get information as to when my website is done and stuff like that out to you. Okay, how's that sound? And if you want to be on my mailing list too, when I do my own webinars for my patients, I'll be more than happy to send you a notice that I'm doing a webinar so that you're included on it. Okay? Because again, we just want to give you, I know that they all feel the same way here, we just want to give you as much information as we can to give you an opportunity to help yourselves better, okay? Is it boring to you? It's all good?
All good.
Yes.
My husband, who was sitting behind me in a wheelchair,
Uh-huh.
an unusual situation.
Yes.
And in 24 hours, he lost his complete proprioceptive
Oh,
nervous system.
jeez. Okay.
And where would you
Yeah.
start? for that?
I would have to start, and see me before you leave, but I would start working on adrenal glands, and I would work on these major glands and these PowerPoints that I showed you. I have ALS patients that I start them on using the microcurrent, and they start getting some good quality. You just want to get quality of life to improve, and I can show you how to help yourself with it.
25 years, and there's been no change whatsoever.
Everything's possible with the human body. The body has the ability to heal and repair and rebuild. Everything's possible with him, starting with him up above us, right? Everything, right? He gave your body an amazing healing ability. His body has an amazing healing ability. It's just a matter of kind of pushing it in the right direction. And that's what I'm going to show you to do, okay? Yes. I'm sorry?
How about heart problems?
Heart problems, again, we would work the circulation in the heart and adrenals and thyroid. And I can tell you those. If I don't get a chance to test you today, I at least will get with me and I'll circle areas to work on for you without testing you. Yes?
Sciatica.
Sciatica would be that one that I showed you. There you go. And that one down here just shows you more specifically when it shows you those two, because you got 2 X's here and 2 X's here, and it just shows you where that is there. Yes?
My question is there in this area in Pittsburgh that does what you do?
Right here.
Right here?
Okay, we
So
want
I
one.
can have that treatment?
And if I can get over here more often, maybe I can be over here sometimes too.
That'd be great.
You just tell them that you want me to be here once in a while, and I'll be here. I'm not sure. You have to talk with Dr. Weiner or Jamie and ask them. My pleasure.
We can purchase it today, right?
You can purchase the units here today. They have them here today for you. Just make sure that if you purchase a unit, you get with me before you go home so I can show you what areas to work on in your specific situation. Okay? So whatever it takes, I don't care how long I have to be here, I'm going to show you what to do. Yes?
I have this thing, it's a pen it's called, where you apply the
Pens is
electric current.
take the window, open it, and throw it out the window. Because I didn't show you the slide, but TENS works against you, not for you in the end. Microcurrent is light years ahead of what it does for you internally. It's unbelievable, yes.
Major PowerPoint, the knee.
Yes.
The person has a knee replacement.
Yes.
Do you still use that as a major
Yes,
PowerPoint?
yes, absolutely. No problem. No problem. What else do we have? Yes.
It's called post-vitreous displacement in the eye.
Post-vitreous displacement. Any kind of eye disorder issues, you always want to work the, let me get to it. Oh, there you go. You want to work circulation for one, because it's always dependent on how much blood flow is getting there. Because see, what happens as we age, there's these little vessels in the eye that plaque. We actually start plaquing starting at the age of 8 years old. We start literally plaquing up. Some plaque faster than others, depending upon if you have a heart disease history in your family background, or if you have diabetes in your family, you'll plaque faster. And those folks are the ones that literally develop some issues down the road in their eyes. So by working on the circulation, and then also taking, and there's areas around the eye that you just go around with the eye with it. And then there's some supplementation they have here that you can take that opens up the blood vessel, gets more blood flow through that area. That's what I recommend in dealing with any kind of eye disorder, whatever it is. Yes?
I had my cataract.
Yes?
I had the
Yes?
and now all I see is floaters.
Yeah, you're always going to get floaters.
So what do you do with that?
Same thing. You want to work on circulation. You want to take this and go around the eye and find hot spots. You want to get on the Nutritional Frontiers protocol they use to improve, work on the eye, improve the blood flow, which one of them is, there's a remedy they have here. It's wonderful. It's a tincture called Circucare. Circucare for the extremity, and it increases the blood flow through the vessels. It's wonderful. It works on the whole body, and it can help the eye tremendously. No, you take it internally, but it'll improve the blood flow tremendously. Yes?
Have you had much success with people that would have like weakened cranial nerves? Weakened cranial nerves?
Yes.
Had
You
success?
can, yes, absolutely. Because again, you go right up in the area with it. In effect, just taking it and contacting it in the cranial area, along there. And just go just all that area of the cranial area with it. Absolutely. Anything else? Yes?
And the way you know you have a hot spot is if you feel needles and pins.
Yes, either you're going to feel a hot spot is pins, needles, a pulsing, burning. It's different things to different people, but you feel something. 150? They have the units available for 150. Actually, that's a really good deal because it has multiple applications. We even haven't touched on the weight and cosmetic applications of it. Today, we just covered the healing, acceleration, and pain. But at another time, if you have one, I'm going to teach you about what points to use for weight loss and for cosmetic application. What else do we have? Any other questions? Yes?
Someone did ask about cataract, right?
Cataract, yeah. Just circulation around the eye and the protocol from Frontiers. Anything else? So here's yes?
What if you want to kill fungus or cancer?
Virus, bacteria, parasite, and yeast. The question was, again, you just go right to the colon. And you're going to get on Candestat, Microgon, and use that and get on a yeast-free way of eating. Okay? Anything else? Okay, so what I'm going to do now in the next few minutes, I'm going to start with, okay? And then as you're signed up on the list, I will come and get you, okay? So make sure before you leave, when you're getting a mighty mini, do not leave until I have at least send you home with what to do for your particular situation. Thank you very much.
Didn't you get tested?